I don't have a crystal ball to know what the future of psychiatry holds, but I know that there are some key elements that are going to be in psychiatry. I think choosing a residency, you want to choose a residency that exposes you to everything that you can possibly learn and really prepares you to face things on the outside. So we have a unique department because we're growing and thriving and really dynamic, which is a little bit unusual in these times. We're known for our psychotherapy curriculum, but we also have a very strong neuroscience curriculum, which is unusual to have both strong psychotherapy and strong neuroscience. We have a robust neurointerventional program, so residents get a broad exposure to ECT, TMS, esketamine, which is not something you usually see in such a strong psychotherapy program. Seeing a lot of complex care, seeing things that you probably never see again in your life, that's wonderful to get to do that during residency.
I actually felt very prepared, and I learned that when I went to do my sub-I, and I was given a lot of feedback about how independent I was. You really don't know until you step out and do something else when people start saying, oh, you did this on your own, this is already done, and I'm like, is there another option? And that's what they kind of teach you here.
To have a broad experience where you get to see everything, inpatient and outpatient, both medicine and psychiatry, really provides you a nice breadth of exposure for figuring out what you want to do after.
Residents that graduate from our programs really can do anything they want. They can go do a fellowship anywhere in the country, they can go into academic medicine, or they can start a private practice. They have a robust training that really prepares them to do anything their heart desires. We have the general psychiatry residency, which when I came 4 years ago, we had 4 residents per year. We've grown to 6 residents per year. We have the med psych program with 2 residents per year, so that's 10 residents total in the med psych program. And those residents split their time between internal medicine and psychiatry. The child fellowship has 2 fellows per year. We have residents and faculty who have come from all over the country, all over the world really, many of whom are leaders in the work that they're doing. Because of the diversity of experiences that our faculty have, residents get to learn lots of different ways that are all equally effective at approaching the same clinical problem.
The program here is very warm. The relationships between attendings and residents and students are often very, very positive. Most residents feel really comfortable talking to attendings, asking them questions, feeling like they can have open conversations without feeling fearful that they should know something. So it provides a kind of safe space for learning.
Just that feeling of not getting lost or left behind. I always felt like if there was ever a problem, I always knew who I could go to.
I love living in Springfield. Springfield is a small town, so it's easy to get around, but it has all the amenities that you would want in day-to-day life. We have a ballet, we have a symphony, we have festivals downtown, music festivals, art festivals, but it's a small city, so it's easy to live. So we're one of the few residencies across the country that has a medical educator track. This is a 2-year program that residents and fellows can apply into, and we take residents from both the general psychiatry and the med psych program. During those 2 years, residents will attend didactics that are special for this program. They also meet with a mentor. They have a mentor assigned throughout the 2-year period to really talk about the professional identity development of a faculty physician. This is designed to train our academic psychiatrists of the future. So this is something that's very appealing for both residents who want to be academic psychiatrists, but also for the academic departments that are going to hire them upon graduation.
Some people say if you can't teach something, then you don't really know something. And I'd agree with that. To be in an academic institution where you're constantly challenged, asking yourself, do I know what I know, and what do I need to learn that I don't know, is just, it's the best place to learn.
We're looking at redesigning the behavioral health system of care. We know that there aren't enough psychiatrists to meet the needs, and there won't be enough going forward into the future. So we're really trying to figure out how we can provide psychiatric care differently. We're really looking at how do we provide care for Central and Southern Illinois, and the residents are part of that. They get to try new ways of delivering care. They get to participate as we begin pilot programs. Before everybody was doing telemedicine with COVID, we already had a robust telemedicine program, and those are all curricular elements that are built into our program.
I think the biggest thing is really starting even as far back as med school here is the problem-based learning. And so you're really taught to see patients as a whole. It's not, okay, you're just doing embryology. This case has embryology, psychiatry, genetics. everything at once, and so it really helps me to not just look at the psychiatric component of a patient if there's something going on.
This is the future of psychiatry, so we need to train psychiatrists to really work at the top of their license and work collaboratively with our primary care colleagues, with other health professionals who work in this space, so that we can all collectively work to improve mental health care for this country.